Hi everyone, I'm Jennifer Bruns and this is my presentation for my project in this class. I am a bachelor degree student at McKendree University in Lebanon. I've been shadowing Mindy, the house supervisor at Redbud Regional Hospital, for 40 hours of clinical practicum experience during this class. I normally do not work at Redbud, but I do not work as a floor nurse, and nor do I really work in a role that would benefit me in this class. So I decided to do this so I could get some experience shadowing Mindy. My presentation here is going to be on nurse retention, and I'm going to do things a little different tonight. Because Redbud Regional is a small hospital, typically it's short-staffed. I've been shadowing on nights, so midnight, 6 p.m. to 6 a.m. And so we more or less work with a skeleton crew, and Mindy is the house supervisor. We kind of go back and forth in between ER and the floor, which you guys know this, and I can't get everybody in one room at the same time because I would take the entire hospital and put them in a single room to watch me talk for 20 minutes. So in order to give everyone the opportunity to see this, I thought that I would record it, and then that way I'm also not giving the presentation 10 times. And we're going to see how this works, and hopefully my instructor is in favor of this. So the object of this presentation is to provide everybody a little education on what nurse retention is, why this topic is important to all of us within healthcare, things that may cause nurse turnover among your organization and other organizations, any kind of strategies that we can implement that may decrease this turnover and keep these nurses retained within the healthcare organization that we currently work. Once we get them in and trained, we kind of want to figure out what we need to do to keep them in. So nurse retention is the focus on it's the intention of the nurse's reason to stay or leave their current work environment. And we know that it can be an issue among all organizations and for many different reasons. So why does nurse retention matter in my organization? So in any organization, anytime you lose nurses, you're going to have increased costs. So you're going to have these increased costs due to, losing nurses. You're going to have to recruit and train new nurses. You're going to probably have to pay overtime for the nurses that are currently staffed there because now you're going to be short-staffed. You're going to have increased length of stay for patients in the hospital, which you may get dinged for that because we know hospitals kind of want them in and out now, or as fast as we possibly can per insurance guidelines and all that good stuff. If I have a full team of patients and their acuity is high, I may not be able to give you as good a quality care that I want to give. So these patients aren't going to be getting the quality of care that they would if I had a fully staffed floor or nursing unit. And when all this happens, it decreases the satisfaction for the patients, which then hurts your hospital and your organization because you get back your healthcare patient surveys and healthcare ratings aren't going to be as high because you're sending out these surveys and patients are sending them back, and they're not rating you as high because they don't feel that they've been given the care that they should have got. So why is nurse retention important to the patient? Healthcare, improved health outcomes. So your patient outcomes. So like I said, if I'm not around to take care of patients, they may be getting up to go to the bathroom, may need to go to the bathroom and call, and nobody's around to help them. We've all read that article that said, when we have adequate staffing and patient call for car lights, one of the biggest things they fall is when they're getting up to the bathroom and no one's there to help them. So we have safety issues when we're not adequately staffed. There's decreased length of stay when when hospitals are fully staffed, there's decreased length of stay for the patients. So when we're not retaining these nurses, these patients are going to be staying longer in the hospital because they're not getting the proper treatment they need to get them healthy and get them out the door. The improved quality of care delivery. So, I'm not going to give as good a care if I'm overwhelmed because, I'm being taken away from the patients down the hall and I may overlook giving, a dressing change. A simple dressing change may be put off till the end of the day because I just didn't have time to do it. I'm going to make the patients happy either. So why is nurse retention important to nurses? Well, it decreases satisfaction among us nurses. Nobody likes to work short-staffed. We get stressed out, we get fatigued, we get overwhelmed. A bad work day can make for a really bad week. It sticks with us sometimes. We get burnout. If we're working short-staffed all the time, it wears on you. If short-staffed units, sometimes we're asked to pick up overtime. It's never forced. It's never been forced on me. I'm sure maybe there's places that they do have mandatory overtime. But, if you're short-staffed, people are going to have to help pick up the slack when you don't have the staff. You're going to have higher patient ratios. You're not going to have the staff to pick up and have a small team. You're not going to be able to look at acuity as closely as you would if you were fully staffed. So you may get pretty heavy teams and pretty demanding patients to care for. And again, patient safety. If I'm short-staffed and overwhelmed, I may not see those subtle changes in my patient that I would have saw had I not been so overwhelmed and worked. Because I'm not in the room with the patient as much, I don't get to know them as much, and I don't see when these things start to happen. So what is safe staffing? Safe staffing is a big topic. It's always a big topic in the news and, and among nurses. There's, multiple groups that go to DC, I know, to fight for safe staffing. Safe staffing, there's not a magic number. So if you don't have adequate staffing on the floor, you will have unsafe staffing. And there's no magic number because this can vary from the experience of a nurse. So my experience as a nurse is going to be very different than that of a new grad because I've been a nurse for quite a few years. So I can have a higher acuity patient than the new grad. So I may be able to take on more patients than that new grad. Also, I may have patients that have a lower acuity or may have a much higher acuity than that new grad, but she has we don't have equal numbers. So where I may be able to take 2 or 3 patients with a high acuity, she may only be able to handle 1. So there's no real magic number to answer this question on what safe staffing is. It's kind of going to be up to your unit, your facility. There are tools that some facilities use to kind of help determine what good staffing guidelines are, what good I can't think of the name right now. Anyway, there are some tools that people use to, determine like what the acuity of the patients and help write assignments that way. So when there's not adequate staffing, patients are at increased risk for falls. It's kind of the same things as when, the other things, you're higher risk for falls, infection, medication errors. You may not notice change in patient condition, which sadly can lead to death if it goes on for a prolonged period of time. So factors that nurses may leave. So turnover for nurses is going to vary from person to person and facility to facility. As a nurse who's been around for a while, I've become, somewhat thicker skinned than a new grad. And some things probably aren't going to upset me like they would a new grad because I've already dealt with them. It's kind of old news for me. So it kind of rolls off my back a lot easier. And I'm probably not going to want to leave over the same reasons that somebody else may leave. And we're just two different people. Some people are more sensitive. Some people, we have different beliefs. We have different feelings. We have different backgrounds. We have different backstories. So everybody's different. And this isn't always a easy thing to answer either. Turnover can vary from person to person, facility to facility. It can be related to incivility or aggression on your unit, any kind of workplace characteristics you don't get along with. If you have any leadership or management issues, you may not be satisfied with your job. Maybe you're now working on a ortho floor and you decide you don't like ortho, you want to be a labor and delivery nurse. That could be a reason to leave. There's nothing really wrong with the unit. It's just not your thing anymore. I transitioned from a cardiology nurse that I had been for years to research. Just was time for a change for me, and I found that I really enjoy research. Never thought I would, but I'm really enjoying the change in role. Could be related to, people can leave for work-related fatigue and stress, burnout, salary reasons and benefits. You know, if you find out there's a job opening that's offering more money, better salary, better benefits, you know, to look into leaving that facility. Letter of resignation, reasons nurses leave and turn in this letter of resignation, burnout, lack of satisfaction within the role that they're currently in. Like I said, you know, you may just find that this role is no longer something that you're interested in. Maybe you've done it for a long time and you just don't like it anymore. There's been changes on the unit. There's been things implemented that don't match with your beliefs and your personality, or things that you find important to you, and you could leave for that reason. I know people who have gone and left and worked with private practice physicians, and even though they loved working in the private practice and doing the things that they did within that facility, they didn't have the same beliefs and the same morals, I guess, as the physicians, and they had some conflict, some internal conflict, and left for those reasons. Leadership styles can play in. You know, I don't want to sound like we're picking on leadership, but this can be a big thing for some people, because, you know, I've had people tell me that they felt like leadership was picking on them, or not supporting them in ways that they felt like they needed to be supported, or backed up in ways they needed to be backed up. And these were reasons that they started looking outside of the organization that they were currently employed and found employment elsewhere. Conflict with coworkers or leaders. You know, another reason for nurse turnover is conflict. You know, it happens. We all have a personality, and sometimes it just doesn't mesh with somebody else. You know, hopefully that we can find a way to come up with a resolution for this, but it's not always possible for everybody. So, you know, there was an article written by Kang, Lee, and Coy. It defines conflict as interpersonal incompatibilities among group members, which typically includes tension, animosity, annoyance among members within a group. You know, so whenever you've got tension, conflict, it creates increased stress, and the communication is poor. You have a communication breakdown among these coworkers. This can definitely affect teamwork. It can affect performance on a unit. You know, one big thing that it can affect is the sharing of resources, which is pretty important in nursing. So let's say if I am working with another nurse and we don't get along, we have poor communication, we have animosity and conflict, and we're not going to communicate a lot. We're probably going to be on a very yes ma'am, no ma'am level, you know. And if I have come across, you know, a new resource, you know, that I'm using for a drug book or look up a diagnosis or whatever it is. So I come across a new resource, I'm probably not going to be like, hey, Sally, oh my gosh, guess what I just found? I found this new thing and it's great and you should use it too. I'm just going to keep it to myself and probably tell my friends or my coworkers that I do get along with very well. So we're probably going to not share resources and not help each other grow as nurses and as a unit if we have this conflict and animosity. So when nurses can learn to work together as a team, as a unit, it increases the overall success of the unit, and therefore it's going to increase the success of our patient outcomes and everything. I mean, it really does help everything on a unit, and you're more inclined to have your you're going to have higher staff retention rates, because if everybody gets along, you become like a family, you become like a unit, and you work well together. And I will say that this is something that I have seen at Red Bud Hospital on nights, that everybody works very well as a team. They have each other's back. They're very good about helping one another when they need to. But, you know, that is something common that you also have when you're in a small facility, because you have to learn to rely on each other. If you guys didn't work together well, if you guys didn't help each other, when something bad happened, you would drown. So you have to learn to team. So another reason that you may have issues with nurse retention and turnover is, we discussed this previously, compensation. If a nurse doesn't feel that she's being adequately compensated, her salary's not great, she may look somewhere else to see if they're paying more. Benefits, you know, we all want to retire someday, so we kind of hope that there's a retirement plan, and medical and dental and vision. Because you see, I got these things on my face and these glasses are expensive, so I like to have vision insurance. And you know, we don't want to work 24/7, 365, so we would like to have decent hours and flexibility. And you know, if a schedule isn't flexible and you know, we can't take off when we need, these are other reasons why people may start looking for employment. So why is nurse retention important to leadership and management? You know, a lot of times as a floor nurse, you know, I have heard people say that, you know, nurse retention, nurse turnover rates, it's not my problem. You know, it's management's problem. But, you know, it's not, it's everybody's problem, but it does, managers do need to try to maintain competent nursing staff, you know, because, you know, competent staff in your facility helps increase your patient scores and you know, your patient outcomes. When you lose these nurses, sorry, you have a large financial cost associated with nurse turnover, cost of recruitment and orientation for new nurses. You may have overtime. If there's issues associated with poor staffing, you could incur other costs as well. You can have decreased satisfaction scores, which are going to show up on hospital surveys. You're going to have decreased job satisfaction. You're going to have increased job stress. You'll have decreased nurse productivity. You're going to have increased patient-nurse ratios. Your patient outcomes are not going to be as good. You're going to have increased the patients. So all of these things we know are not great things, and we want the nurses to, or the nurse managers, management and leadership, they want to try to keep these nurses within this facility. We've got them there, so we've trained them, let's keep them. Solutions and strategies or to improve retention, sorry about that, there's a typo. So we could assign nurse mentors to staff, especially new staff, new grads, to kind of help them transition until they're comfortable. We want to always make sure that there's a person that staff feels comfortable going to ask questions. We all have questions. I've been a nurse a long time and I still have questions on a regular basis. And we need to be able to give them a resource to find answers for these questions. We need a supportive work environment. Resources and strategies to manage moral distress. Whenever something's going on, we have to provide support. That's the big thing. We need to support one another. We always have these annual engagement surveys that want to know how we're doing and, you know, do we like our job and what do we think and all that stuff. But, you know, maybe you could do something above and beyond the mandatory. Do them, you know, quarterly, just to, you know, check on your nurses, see how they're doing, because sometimes they're not going to tell, they don't feel comfortable telling you, but they'll write it on an anonymous survey. Teamwork. We have to encourage teamwork among our staff. The better we work as a team, the better outcomes we have. Collaboration, autonomy, you know, let our nurses be autonomous, and support each other. So we're going to probably do questions on an individual basis since we're going to be trying this a little differently, and I'm going to send you some, we may feed into this. So conclusion. So nurse retention is a challenge to healthcare organizations and leaderships everywhere. So all healthcare organizations have an issue with nurse retention and turnover rates, and we're trying to figure out ways to keep those nurses in, keep them trained, and keep them within our organization. It is a big financial cost for organizations to hire these nurses, train them, get them through orientation and training, and then lose them to another organization. So the issue of nurse retention and turnover is not just a leadership problem, it affects everyone. It affects the floor nurses, it affects your patient care techs, it affects the patients. The entire healthcare organization is affected by nurse turnover and retention. Communication and teamwork nurse retention is possible, it's probable. If we can all communicate and work as a team, there's a high likelihood that we're not going to want to leave and we're going to stay with those people that we've developed these relationships with because we support one another and we feel like each other has each other's back. Implementing programs to strengthen relationships and support in the organization has beneficial long-term effects. And then these are the references that I used. I used 5 different articles that I printed off the internet from the library at McKendree University. So thank you for now. I may feed in some more stuff. Have a good night. Let me know if you have any questions. Thanks.